Hello everyone. Today, we're exploring the medication enoxaparin, widely known by its brand name, Lovenox. This session is designed for educational purposes. For any health-related questions or concerns, it's crucial to consult with a medical professional. Description: Enoxaparin, commercially recognized as Lovenox, is an injectable anticoagulant that belongs to the class of medications known as low molecular weight heparins, LMWHs. Its main role is to prevent and treat blood clots, thereby reducing the risk of developing complications such as deep vein thrombosis, DVT, pulmonary embolism, PE, and strokes in patients with certain types of heart conditions. It is often prescribed for patients undergoing surgeries, especially hip or knee replacement surgery, to prevent blood clots. Additionally, enoxaparin is used in the treatment of acute coronary syndrome, including unstable angina and certain types of heart attacks. The medication works by inhibiting certain factors in the blood clotting process, making it an effective anticoagulant. Warnings: Enoxaparin should be used with caution in individuals with a known allergy to heparin or pork products, as it may cause allergic reactions. It's also not recommended for those with active major bleeding or a history of heparin-induced thrombocytopenia, HIT, a condition where heparin causes a decrease in platelet counts, leading to an increased risk of bleeding. Special caution should be exercised in patients with kidney problems, as dose adjustments may be necessary. Before taking this medicine. Before starting enoxaparin, inform your healthcare provider about any existing medical conditions, especially if you have a history of bleeding disorders, high blood pressure, kidney or liver disease, or if you are pregnant or breastfeeding. The risk of bleeding is higher in individuals with certain medical conditions or those taking other medications that affect blood clotting. It's essential to discuss all medications, vitamins, and supplements you are taking with your healthcare provider to avoid potential interactions. Side effects: The use of enoxaparin can lead to side effects, the most common of which is bleeding. Other possible side effects include bruising, pain, redness, or swelling at the injection site. Serious side effects may include signs of bleeding such as prolonged bleeding from cuts, increased menstrual flow, bleeding gums, nosebleeds, coughing up blood, or blood in the urine or stools. If you experience any signs of serious bleeding or allergic reactions, such as difficulty breathing, hives, or swelling of the face, lips, tongue, or throat, seek medical attention immediately. Interactions: Enoxaparin may interact with other medications, especially those that affect blood clotting, such as aspirin, nonsteroidal anti-inflammatory drugs, NSAIDs, and other anticoagulants. Inform your doctor about all medications you are taking to manage potential interactions effectively. Dosage: The dosage of enoxaparin depends on the condition being treated, the patient's kidney function, and body weight. It's administered as an injection under the skin or into a vein, and the duration of treatment varies based on the medical condition and response to therapy. It's critical to follow your healthcare provider's instructions precisely and not to change your dose or dosing schedule without consulting them. Avoid: While on enoxaparin, it's advisable to avoid activities that may increase your risk of bleeding or injury. Use extra care to prevent bleeding while shaving or brushing your teeth. It's also recommended to avoid alcohol, as it may increase the risk of stomach bleeding. FAQ: People often inquire about the necessity of laboratory monitoring while on enoxaparin. Unlike warfarin, another type of anticoagulant that requires regular blood tests to monitor its effects, enoxaparin usually does not require frequent monitoring of blood clotting parameters in most patients. However, monitoring may be necessary in certain situations, such as in patients with kidney dysfunction or those at a high risk of bleeding. Closing. That concludes our discussion on enoxaparin. This information is provided to enhance your understanding and is not a substitute for professional medical advice. Always consult your healthcare provider with any questions or concerns about this medication. Thank you for joining us.